Here at Tennessee Wesleyan, we use simulation as an educational tool to help bridge the gap between classroom experience and real-life experience. So we create scenarios that we've seen in the hospital before to allow students to practice those scenarios before they're taking care of real-life patients. Most of our mannequins are real-life cast from a real-life person. So any freckle, scar, vein on the mannequin is actually on that person who's out there living. It gives the students a more realistic feel when they're doing their assessment or they're practicing skills on those mannequins. And we have mannequins for classes such as pediatrics, OB, and adult, so we get a variety of disciplines too in our simulations. We can do different things where we might create a injury on a patient, or we might create an IV on a patient. They can also practice skills inserting IVs, and we have a monitor to go along with that that will show vital signs that will help the students work through the scenarios to decide what's going on with their patient. I think for a lot of students is they get nervous once they get into real life and real patients, and so this gives them an opportunity to practice with those mannequins. A lot of mannequins will have pre-recorded voices too that will play over a speaker, so they can have that interaction, and I think it calms their nerves. That way once they go into taking care of their patients, they're like, okay, I've walked through this before, I've done this before. It's not just memorizing the list of symptoms for a test question. Students say they wish they had more sims when they get done with the program, or could create sims themselves to pass on to other students, which is really fun. And I just love working with the students in sim because it prepares them for a fast-paced, very dynamic, crazy world of real nursing.
Experience learning beyond the classroom in one of the most advanced nursing simulation labs in the country at Tennessee Wesleyan University.